Nau mai, haere mai, welcome. After heart surgery, whether it's a bypass graft, valve repair or valve replacement, you'll spend some time in the ICU. For me, it was a valve repair, and I'm here to tell you what it's like being in the ICU, from the equipment and people around you to what you can expect to happen while you're there. After your surgery, you'll be moved from the operating theatre to the ICU while still asleep. And there you'll be looked after by the ICU and cardiac surgery teams. When you wake up, you'll have a lot of medications on board. Some people feel a bit sleepy or confused, although this usually passes within a few days. Some people may not recall their ICU stay at all, although I remember feeling relieved that the surgery was behind me. You'll have a breathing tube in your throat connected to a ventilator. This helps you breathe while you're under anaesthetic. The tube can feel uncomfortable and you won't be able to speak while it's in place, but it's usually removed soon after waking and will be replaced with an oxygen mask. You'll be offered ice chips or small sips of water and may even be able to eat the next day. You'll be connected to a monitor that tracks your vital signs. If there are any changes, a machine alert will let the team know. This can be unsettling, but it's pretty normal and doesn't necessarily mean there's an emergency. You'll have lots of tubes and wires attached to you, including intravenous lines giving fluids and medications, such as those helping to support blood pressure. Wires attached to a pacing box, which may be used to increase your heart rate, and drains to help remove air and fluid from your chest. These are usually removed 1 to 2 days after surgery. I remember the drains limiting my movement and feeling uncomfortable when taken out. I was relieved when they were gone, as it was a good sign of progress. You'll have a chest scar and, depending on the type of surgery, you may have incisions on your legs or arms too. Nurses and physios will start your rehab as soon as possible. Even with all the equipment attached, they're keen for you to do deep breathing exercises and to get moving, because it helps you bounce back faster. Keeping you comfortable is really important. The nurses will ask if you have any pain or nausea, and you'll receive strong medications to help manage these for the first few days. Do speak up if anything is bothering you so that the staff can help. You won't need to get to the toilet when you're in the ICU, as you'll have a urinary catheter and you likely won't have any bowel movements for a few days after surgery. But don't worry, the nurses will help you take care of all your hygiene needs. Your whānau may be able to visit you as soon as you're settled in after surgery. It can be tough for them to see you connected to so many machines, but they'll be relieved the procedure's over. If they can't be there in person, the team will provide regular updates by phone. Once you're well enough, you'll be transferred to a step-down area. This is usually the day after surgery, but it can vary as everyone recovers at their own pace. After the move, you'll continue to have the support of a skilled team as your recovery enters its next phase. If you have any questions about the ICU or what happens next, check in with the team caring for you. All the very best as you prepare for your surgery. Nō reira, tēnā koutou, tēnā koutou, tēnā koutou katoa.